Hi, everyone, and welcome back to the 2018 Pediatric Summit webcast. Today, I am here with your new host, Allie.
Hi.
And this year's Pediatric Summit will be October 4th through the 7th. Just kidding, 5th through the 7th. And this year, we will be offering CE credits. So it's going to be a little longer. We're going to have CE there. And we're expecting a great turnout. Today's episode on the webcast is going to be sponsored by Chiro Futures. So thank you, Chiro Futures. They are the only malpractice that supports subluxation-based practices. So we really appreciate that. And today I would just like to introduce Allie real quick. She is in her 10th quarter here at Life University, and she will be leading all the podcasts from here. It's awesome to have her. She's my best friend, so I'm really excited to introduce her. But Allie, you want to take it?
Hey guys, welcome to the webcast. Today we'll have the pleasure of talking with Dr. John Chung. He is a doctor in the Palm Springs, Florida area. He is a CE speaker on concussion, and he's only one of 300 docs trained in the Nuka technique. So without further ado, here's Dr. John Chung.
Hey guys, thanks for having me on the show. Looking forward to being at the summit and being able to share some of my thoughts on upper cervical care and how it can relate for the pediatric patient.
Awesome. So I guess maybe not a lot of people know exactly what the specific technique you do is, and it's called Nuka. So maybe could you explain a little more about that and how it works, how it relates to pediatrics?
Sure. So Nuka is an upper cervical technique that is born from the Grostic lineage. So if you're familiar with Grostic, Grostic includes things like Atlas orthogonal, advanced orthogonal, orthospinology, and Nuka. And the goal of the Grostic techniques, the orthogonal techniques, is to get the head and neck into 90-degree angles, or at least as close as possible to that, so that the atlas and all these surrounding structures are in its ideal position. And, whether it's from a pediatric standpoint or an adult, the goal is always to maximally reduce the atlas subluxation on people so that they could get the best neurological function coming from their head and neck. They could get ideal function going into the brainstem and just whole body, whole structural health, just because we've established a really strong connection and influence on the upper cervical part of the spine. So whether you're a kid that is, doesn't have any problems at all, or whether you're someone with, chronic neurodegenerative disorder, getting the head sitting on top of the neck right is just a really important piece to the whole puzzle of neurology. And Nuka is just my calling as far as how I will choose to deliver that.
Awesome. How did you find out about Nuka? Have you always practiced Nuka?
I've always practiced Nuka since I've been in practice. I came across Nuka when I was in 10th quarter, just kind of where you are yourself. And
Exactly.
During 10th quarter, I listened to a speaker, his George Gertner, and he was talking about how he, used Nuka at a really high level. And I shadowed his office up in New York. And I thought, this was a really cool approach to chiropractic. And I've always been intrigued by upper cervical, but even though I was, pretty hard into Gunstead at that time, there's something about upper cervical that just drew me towards it. I ended up doing an internship with a Nuka doctor in Atlanta named Brian Salmonen, and was just seeing just unbelievable stories of healing. People with Parkinson's disease whose tremors were going away, people with complex regional pain, people with fibromyalgia, and all these really challenging, tough cases were getting better. And that's when I decided, wow, this is just like a completely different patient population that I was used to seeing at a chiropractor's office. And that's when I decided, this is something that I want to do. This is the type of people that I want to help and influence. And, this is, how I'm going to practice chiropractic, because I want to be able to help these people that feel like they haven't had the right answers for them, and if Nuka was going to be that way to bring these people into the office and help them, and that's what I wanted to do for my life.
Awesome. So I know you also are very involved with the world of concussion research. Can you maybe touch upon that a little bit?
Sure. So I got into concussions just through the process of taking care of patients. Being in Wellington, we see a lot of people that are equestrians. So they do horse sports, they do horse jumping. And one of the natural consequences of riding on horses a lot is that eventually you're probably going to fall off one day and you're probably going to hit your head one day. And I started taking care of a patient who was a 16-year-old girl, and she was having chronic dizziness, chronic headaches, some signs and symptoms of dysautonomia. And she had these symptoms for about 3 months after having a concussion, while she was riding. And, she had seen vestibular rehab specialists. She had been to, neurologists. She had been to, other types of chiropractors. And when she started getting adjusted by me, within about 2 to 3 weeks, her symptoms were about 60% better, and she was able to start riding her horse again. And that was really cool. And I thought to myself, wow, I mean, what if concussions were just a manifestation of some of the physiology that we see when people are having a bad atlas subluxation? So I just dove myself into the research and looking up, what's the physiology of a concussion? What are the things that happen when someone hits their head? And what are the things that happen when someone has an atlas subluxation complex? And I started to tie the pieces together. I started to look at research showing, the chronic effects of concussion, how it causes neurological disease. And then when you combine that with some of the things that upper cervical doctors are seeing with neurological disorders like MS and Parkinson's and things of that nature, then it just made an easy transition. Like, all right, if concussions are causing some of these brain illnesses, then are there some similar ways that someone with a neck injury is going to have some of these same problems? And that's where I started to put a lot of these pieces together, and it's where I talk about in a lot of my presentations now, so that, if upper cervical can make itself a go-to professional for people with these types of disorders, and I think that's going to make a big impact on the world, and it's going to make a big impact for chiropractic as a whole.
Cool. I think there's a lot of maybe I'm just as a student mindset. There's fear out there when you think about someone into your office who maybe just recently suffered a concussion or has post-concussion syndrome, has had multiple concussions. Did you start out having any of that fear, or how did you maybe get over that fear?
Yeah, and it's something that, we should all be a little bit fearful of when we're dealing with this type of patient, because these types of patients are pretty neurologically sensitive. They're really neurologically fragile. And plus we have to rule out, things that are potentially dangerous for that person. So you don't want to, the person that has a brain bleed is not the person that you want to see a chiropractor first. You want to get them stabilized from an emergency perspective first. And then once they're a little bit more stable, then you can start working on, fixing their neck. So you have to be able to identify when someone is not a great candidate for your care at that moment in time, and get them to the person that they need, so that they will eventually come back to you so that you can start to help them. So yeah, there is a little bit of fear, and we should all be a little bit afraid of that, because that keeps us sharp. It keeps us on our toes for when, someone might be in an emergency situation. That being said, when someone has chronic issues from a head injury, then upper cervical chiropractors and chiropractors in general are really well equipped to be able to take care of these people, because the adjustment has such a powerful impact on neurology. And if you could adjust these people are going from doctor to doctor looking for help from their post-traumatic headache or their post-traumatic dizziness. And the biggest thing that they may need sometimes is an adjustment. And when you see that happen in real time, so, maybe not the person that is fresh off a concussion, 2 days ago, but the person that's been suffering with these post-concussion symptoms for a month, 2 months, 3 months, years, those people need what we do almost more than anyone, because their quality of life is really poor at that point. These people are used to playing sports. They're used to being really sharp in mind. And because they've had a head injury, they don't feel that way anymore. And it's on us to help them get their life back.
That sounds great. Sounds like a good idea. Do you have any like specific protocols you do with adolescents, especially that come into your office? With
adolescents, my protocols don't change a whole lot because we focus a lot on, looking at their posture. We do a pretty thorough neurological exam with them. So we look at their eye movements, we look at their postural control and stability, we look at their gait, and then we look at things like their x-ray findings and their leg check and things of that nature. So we're combining elements of, a thorough neurological exam with a strong chiropractic exam. And one of the cool things about it is if you're doing a really good job for that person chiropractically, you're going to see those findings on the neurological exam improve, whether it means that, someone not being able to stand up straight with their eyes closed, that's a Romberg's, right? So if you take good care of a person, then something like a slightly significant Romberg's finding where they start to sway too much, that is probably going to get better. Or if you see that their eye movements aren't really smooth and accurate, then if you adjust them properly, then one of the things you should start to see is that their eye movements should start to improve too. So, there is no exact right way to do this, but, you should take all the things that you've learned in school, know what they mean, know all the parts of the anatomy and physiology that they're affecting. And then when you do an adjustment, see if those things get better. Because, if chiropractic is doing what we're saying it's doing and it's getting a person better neurologically, and those are some of the things that we should start to see improve and start to see change. And that's super important with kids because, kids, they might not be able to tell you the best thing that they can subjectively. So it's on us to be able to use reliable, objective findings to measure their improvement. And, especially with kids, just getting them to stand up straight with their eyes closed and see if their balance is okay is a good way of testing that. Or looking at their primitive reflexes is a good way of seeing if they might have regressed a little bit from their head injuries. So those are some things that I find really valuable in the kid population.
In your office, as far as treatment, besides adjusting, are you giving them any neurological exercises, or are you leaving that for someone else and sticking to adjusting in your office?
I've been trained in some of the Carrick Institute work, so I will do some eye movement exercises for certain patients, and I'll do some primitive reflex exercises for some patients. But everything for me starts with the adjustment. So I'm always going to see what their atlas is doing first, and then my first intervention is always going to be an atlas correction. And then I see what else is remaining after I've corrected their atlas, and I've done a good job with that. Because one of the beautiful things about upper cervical is that we spend a lot of time trying to not adjust the person, right? So that's one of the cornerstones of upper cervical is we're looking for reasons not to adjust someone. And on those visits where we're not adjusting someone, then, that's when we could start to get into some of these neurologically based exercise where we could give it to them, work with them, and see if that helps them improve and makes them recover a little bit faster, especially when we're dealing with like a head injured type of population.
Is there ever a case, I know you mentioned when it's super extreme, like brain bleed, is there ever cases where you adjust on the first visit?
Can you say that again? You broke up a little bit on that.
Sorry. Is there ever a case where you wouldn't adjust on the first visually?
Yeah, I mean, if they are showing some really gross signs of neurological deterioration, so if they're showing signs of like a stroke, where they're showing, pretty bad nystagmus, if their eyes are, one eye is significantly higher than the other, if they're showing, facial nerve symptoms where their face is drooping or they can't, like just all these signs of like there's something catastrophic going on. Yeah, I won't adjust that person on that visit. Whenever we are assessing someone, especially in this day and age where people are associating stroke with chiropractic, if someone has neck pain, if someone has headaches, if someone has dizziness, these are all things that people are going to see you for on a daily basis. We have to be good stewards of our profession and good stewards of the patient to make sure that, they're not having a stroke. And if they're showing some of these really gross neurological signs and they're all coming together and it's saying, this person is bleeding inside of the head, yeah, I'm not going to touch that person. A, because, that puts you, your license, and your practice at risk. And B, even more importantly, it puts that patient at risk for something that, they don't need that intervention at that time. They need something else at that time. And worst case scenario, if they go to the hospital and they don't have a stroke, great. They didn't have a stroke, which means it's safe to work on them and you can continue. But if you do have a stroke, then they're at least in the right place in the right time where someone can save their life in that moment. And then, they'll be super thankful for you after the fact. And, sometimes they have a brain bleed that isn't one of those acute ones. It's like a subdural hematoma where, their bleed is pretty slow. And if you adjust that person, yeah, that person might get better for a little bit, but there's still blood on the brain and that person, regresses in between visits. We expect a lot of people, if they improve a little bit, they should be able to maintain these improvements over time. And if they're not maintaining these improvements over time, we should really look to see if anything else is going on. And, we had that case where I discussed in that Facebook group where a patient had a subdural hematoma. They got a little bit better after an adjustment, but then progressively week after week, you see some of these symptoms get worse. And that should always make you say, why is this person deteriorating? Why is this person getting worse? And even if they had some imaging and scans done at the very beginning, just like a small fracture may not be visible on an x-ray in the initial stages of it, sometimes some of these bleeds, if it's slow, it might not show up on the CT scan initially. So we have to be, good clinicians. We have to say, all right, if this person's continuing to deteriorate, what might be causing that? And how do we get this person the right care that they need in those moments where they're deteriorating and they're not necessarily responding to chiropractic the way that we would expect?
What is your general rule with returning to whatever activity they came from as far as after post-concussion?
So I don't do very much as far as returning people towards activity. I leave that to neurologists. I leave that to the neuropsychologists. I leave that to athletic trainers because they're the ones that are baseline testing these kids. They're the ones that are interacting with them in a way that, they have a better ability of what their sports capacity is. Now, the things that I will measure is, does their balance improve? Because one of the biggest things that happens in concussion is you'll see that their balance will get worse whenever their brain isn't right. So if you see someone they can't stand straight with their eyes closed, that's a problem. If they can't stand straight with their eyes closed when they're on an unstable surface, that's still a problem. And if you are taking care of that person and you're starting to see those balance metrics improve, then that's where you could have a conversation with your patient and say, hey, some of these objective findings are starting to get better. It might be time to start having conversations with some of your other doctors and see if you are ready to either get back into the field, get back to work, or get back to school. And I leave those determinations determined by those other professionals. And that way, we work pretty collaboratively with these other professionals, and I stay in my lane, they stay in their lane, and the patient is happy because they're getting cleared by multiple doctors.
What is your network like with other professionals?
That's
a lot of neurologists and stuff like that, since you are specializing in concussions.
I don't work with a lot of neurologists, but I do have one or two neurologists that I work with on a regular basis. I have a lot of dentists that I co-manage TMJ cases with. A handful of primary care physicians, a couple of orthopedists, and some functional medicine doctors. So I like to build relationships with professionals of all sorts. And, whenever someone might not be chiropractically right for me or they have other needs that need to be addressed, I don't really want to deal with a patient's nutrition. Like, that's not something that I look forward to. It's not something that I want to give besides general guidelines. If they want a more extensive workup, then a functional medicine doctor is where they're going to go to. If someone has some orthopedic issues that are not in my wheelhouse, then I'm going to send them to the orthopedist to go get worked up. If someone has something that should probably get diagnosed neurologically, then I'll send them to a neurologist for, EEGs or needle EMGs or other testing that person might need to get an idea of what's really going on with their body. So I refer patients to these people all the time, and some of these people refer to us consistently. So it's a way that I've built my practice, and it's a way where, building collaboration between professionals helps people get a better understanding of chiropractic, as opposed to people on chiropractic making it an island and saying, everything else is bad, only getting adjusted is good, which getting people adjusted is a wonderful thing, and everyone should be able to get checked and get adjusted throughout their life. But we shouldn't be on an island and saying like only chiropractic is all you need and this is the only thing that anyone ever needs, which isn't true. It's being a little bit disingenuous, because people need different things at different times, and we don't have to be everything to everybody. So get the person to the professional they need, and the patient will be happy and they'll thank you for it, and these other professionals will acknowledge that for you too.
All right. Do you have any other thoughts or comments or anything to leave with the doctors and students that might be watching this?
So one of the things that I missed out on in school is, like, at school, it's easy to become super enthusiastic and sometimes even dogmatic about the way that you learned in school. And the thing that you're going to figure out is when you're in school, as much as you learned in classes and as much as you learned in seminars, chances are you probably really know nothing in the big scheme of things. And that's okay. You're not supposed to know anything because, you haven't been in practice yet. And the thing that I probably wish that I would have done a little bit more in school is I wish I would have learned a little bit more from everyone's perspective. It's easy to, when you get super into Gonstead or Thompson or CVP or even upper cervical, that you decide, all right, third quarter, this is all I'm going to do. And this is what I'm going to commit myself to the rest of my life. And that's cool. You should be a master at a method of delivering chiropractic, no matter what that method is. So become really, really great at it. But at the same time, explore some of these other techniques. Figure out, why does this technique see the pelvis from this perspective? Or why does Nuka see the upper cervical spine from this perspective? And then take that and, figure out how you could integrate that into the way that you look at a patient. It doesn't mean that you have to adjust the patient Gonstead. It doesn't mean you have to adjust the person Nuka. But just having that frame of reference to say, all right, I understand why Nuka sees things this way, and maybe I could apply my technique in this other way because I have a better understanding of the way that they see the world. And that includes neurology too, because if it were me, I would have learned all that I could while I was at school and use this as a way to master my ability, not just in chiropractic, but master my ability to take really good care of patients. And taking good care of patients is the way that people build referral-based practices. So if you don't want to build a referral-based practice just based on your charisma and, saying the right things to the patient, being a really good doctor for people is a way that, people will refer to you if you take really good care of people and people can sense that you really care and you're willing to take care of those people. So that's the big thing that I would say if I were going to go back to school again. I would have went back and done the neurology club. I would have spent some more time, even in things that seem a little bit weird, like network and AK, which have really cool, interesting perspectives. But people say, oh, that's kind of weird and looks funny. But if you look at the way that they see the world and see some of the techniques that they use on people, man, they deliver some really cool outcomes for patients, even though the patient thinks it's kind of. So, I encourage everyone to, explore the techniques. Don't get pigeonholed into one thing as the only way that could possibly exist. And, engage and have debates with your colleagues and your other classmates, because that's where a lot of really cool learning can take place.
Awesome. Thank you so much. It's always good to keep an open mind and be reminded to keep an open mind. Thank you.
Thank you for having you. We're really excited to see you at the Pediatric Summit.
Yeah.
Look forward to being there.
Thank you.
Thanks, guys.
All right, everyone, remind you to go to thepediatricsummit.com and purchase your year's pediatrics. And you'll be seeing more of Allie and all the docs from now until October 5th through the 7th. Bye, guys.